Just 6 years from now, by 2030, the Census Bureau projects that people aged 65 and older will account for more than 1/5 of the U.S. population. This game-changing statistic is driving society to rethink how it responds to the health concerns and needs of so many older adults. Fortunately, a movement across the country and spreading globally known as age-friendly health systems is here to help. Welcome to Advancing Health, the podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Since the early 1980s, the John A. Hartford Foundation has been a national leader in improving health care for older adults. AHA has been a key partner in the movement. In today's podcast, Rahat Ansari, Senior Program Manager for Population Health with AHA, is speaking with Rani Snyder, a Vice President with the Foundation, to explore why health organizations of every type should consider participating in an action community and integrating the evidence-based principles of age-friendly health systems into their own care networks.
Thank you so much for being here with us today, Rani. And having worked with you and the John A. Hartford Foundation for many years, I would love for you to tell our listeners today a little bit about the vision and how this work got started.
I would love to do that. Thank you, Rahat. The John A. Hartford Foundation has a very long history in funding in aging. So we started our work specific to aging and health in 1982, which, if you think about it, means 42 years of funding specific to aging. So much of that work started with building geriatrics expertise in medicine, in nursing, in social work, interdisciplinary team care, and ultimately also in a variety of models of care. Our current president, Terry Fulmer, came in about 9 years ago. She brought me in shortly thereafter as the vice president for program, and she was really charged to move the needle. We built all this expertise, all these fantastic innovations, and they weren't spreading the way we really wanted to see them spread for the growing number of older adults in our country.
So we know there's a lot of work that needs to be done, but not enough happening to make it move. Mm-hmm.
That's exactly right. So there was a sort of a frustration on our part because we had been in the field for all those years. You know, we celebrate longevity, apparently also in our funding. There's a frustration with that no-do gap that exists when it comes to the best possible care for older people. So we understood at that point that we needed to determine how to go big. We understood that the way to do that is to build on collaboration and partnerships. And so we partnered with the Institute for Healthcare Improvement. We partnered with the American Hospital Association and health systems themselves, in addition to the creators, the real leaders of creating those evidence-based models and innovations to come up with what we now call age-friendly health systems.
Thank you. That is so amazing to hear, and it's always rejuvenating to hear how this work started and the importance of it, because we all know that this work is just so important. And, you know, one little anecdote that I'll just share is hearing from people participating in our action communities. Everybody knows someone who's getting older. Everyone cares about someone who's getting older and is getting older themselves. So I think that's one other really big driver of this work, that people find a real connection to it. So with that being said, the AHA has an action community coming up in September, and we're looking for folks to join us in that 7-month-long virtual action community. But I'd love to hear from you. Tell us, what's the selling point? Why should an organization participate in the action community? What's the opportunity for them there?
Absolutely. And I'm going to start by stepping a half step back to say what an action community is. So an action community is a 7-month process by which a health system can learn how to implement age-friendly health systems care in their system, in any given site of care, whether it's a hospital or a clinic or a nursing home. So we sometimes get a laugh out of the fact that it's free. The action community is free to join the action community. But guess what? It's not really free.
That's so true.
It's underwritten by the John A. Hartford Foundation because we feel so passionately that this kind of care that is best care, best evidence-based care for older adults at any site of care, from the kitchen table to anywhere they go for their care and then back home again, wherever home may be, that we are willing to underwrite the cost. So I would say to any health system that is considering the increasing number of older adults and some of the difficulties that come with best care for people who have oftentimes multiple and chronic complex needs.
Right.
Don't leave that money on the table. We're putting it up. So they should really take advantage of this opportunity. And that's just one of the reasons. There are a whole host of reasons. Some of the others include the fact that there's really powerful peer-to-peer learning in the action communities because there are teams from other sites of care and other health systems all across the country that sign up for an action community. There often are over 100 different individual units, team units that are doing this work. And that's really cool also. There are a variety of other things that come with it. So, for example, there's coaching support along the way from, in this case, the American Hospital Association, but there are also action communities that are put on by the Institute for Healthcare Improvement.
That's right.
And others.
State-based ones. Yeah,
Absolutely.
definitely.
So there are a lot of ways to go about it. And we, the Johnny Hartford Foundation, don't particularly care where you join as long as you do. It's just that the AHA action community that's coming up is perfect timing.
Exactly. It's all about the timing.
Absolutely. The upcoming action community for AHA starts in September. So the other thing I want to reference, though, with regard to why would you want to join an action community, why would you want to participate in age-friendly healthcare and the movement that it has become, really comes down to outcomes. And this is what is really important to so many hospitals. So I'm going to speak across the board instead of citing a particular either site of care or health system.
I'm sure that's so impossible to do because there's so many hospitals that have such good outcomes. But yes, we'd love to hear a general
You're
sense.
100% right.
Yeah.
100% right. So some of the kinds of outcomes we are hearing about are decreased length of stay. Do these sound like things that hospitals care about? Decreased readmissions.
Right.
The other one that's really interesting, and this is a little more anecdotal than some of the studies I've seen at individual sites, is we keep hearing of increased workforce satisfaction.
That's amazing because it's so important right now to the field in terms of retention and safety and just being healthy, and especially with COVID and the long hours. That is amazing.
That's a winner right there. And we know it's something that hospitals and health systems everywhere are really aware of, really conscious and working on. And then there's this one really cool example of a health system that studied, as a part of determining what the outcomes have been of their age-friendly health systems work, studied time given back to patients and families and not having to go to extra appointments and not having to go for the readmissions, those kinds of things.
Oh, that is so powerful. And that just gets back to the what matters of this, right? As a part of one of the 4 M's. How do you want to spend your time and what matters to you? And that is so huge that you've got some time back to do the things that you love.
Exactly.
Thank
To
you.
speak in sort of hospital parlance, it's back to patient satisfaction. And
Right.
that also matters very much to maybe not the bottom line, well, maybe the bottom line, but certainly to the reputational and other sort of assets of any health system organization.
That's right. That's amazing. So with the age-friendly health systems work, we at the AHA have been doing this for a little while now. And the AHA has released a new initiative called the Patient Safety Initiative. And as a part of that, we're learning that we can expand this and we can bring in folks from all levels of the hospital leadership. And so the one new area that we're looking into is including the board members. And how are you bringing them into the conversation? How are you leveraging their expertise and what they bring to the table? How are you leveraging that to advance the work of age-friendly within your organization? So I know that you, congratulations, have recently become a committee member of the Mid-Coast Hospital, which is part of Maine Health, the Elder and Home Care Committee. So I know that you've been recently appointed to that. Can you tell us a little bit about what your plan is and what you would recommend other trustees to do to ensure that their hospital and health system is bringing age-friendly care to their organization?
Absolutely. So this is a hospital in my hometown, in my home state in Maine, Brunswick, Maine. And so I've joined this committee, and I think that it's really important as we're thinking about the numbers of older adults and the ways that we are serving them to ask the questions that both speak to the needs of a hospital or a health system, and that comes down again to things like lowering costs, improving safety, improving quality, and that also serve the patients. So I'm actually feel really fortunate because the committee I just joined, the Elder and Home Care Committee, has, even before I came, decided to take on age-friendly health systems-based care for their nursing home. And they were in the process of doing that work.
Perfect timing. All about timing, right?
Exactly, exactly. So I don't even have to push it, but I can ask the kinds of questions that raise these issues so that hospitals and health systems and fellow board members are aware that these resources are out there. I mean, if we're talking about hospitals, we're talking about age-friendly health systems, as well as some of the other initiatives that our foundation supports and that are very complementary and integrated with age-friendly health systems, like geriatric ED care. So through the American College of Emergency Physicians and their accreditation for geriatrics EDs, or the American College of Surgeons geriatric surgery verification, which is another hospital-based program. So if you're asking the kinds of questions that indicate that you're both looking at the bottom line, looking out for the hospital, but quite frankly, aware of and understanding and pushing the importance of caring for the older people in that health system, it's a win-win or a win-win-win.
Right.
It's a lot of wins.
Right. Everybody wins. And I think that's a fantastic answer. And in that answer, I actually think I heard a little bit about the last point that I want to take to make sure that we touch on. And again, we've been working together for many years now. And when we started this work, we were really focused on the inpatient setting, which made sense. And we had a lot of impact there. And I would just love for you to talk a little bit about how far we've come and the work that we still have left to do.
Absolutely. And I really want to give credit here to our president, Terry Fulmer. This is very much her baby. I will say I was there at the very first meeting, but I am not the driver on this one. It's been so exciting to see that the ways that this work has taken off, the fact that the 4 M's of best evidence-based care for older adults is something that really has a lot of traction with both clinicians and the public. People understand what it means to ask, assess, and track what matters to older people, to pay attention to medications, to focus on mobility as a measure of essentially function.
Sure. Isn't it so interesting how it just pulls everyone together? Like anybody, like you just said, a provider or a patient, anybody can just easily latch onto it. It's super simple. Love that. But yes, please continue.
Absolutely. Well, and the only one left that I haven't mentioned yet is mentation, which is anything of the mind. You know, if you were a geriatrician, you'd be thinking of the 3Ds, dementia, delirium, depression.
Right.
But really, it's anything cognitive. So we started out, our full group together with IHI and HA and the others, started out thinking about it as a hospital-based possibility, but very quickly realized that that was necessary but insufficient.
Correct, yeah.
And that older people get care that either helps or frankly can harm them in a whole host of settings. So a couple of things have changed over the almost 9 years, I'd say, 8 or 9 years of this work. First of all, we just started a new expansion of the work that is system-wide. So up until now, through the action communities, a particular site of care might join. It might be a hospital unit. It might be an ambulatory clinic. It might be a nursing home, as I mentioned. And those sites are a single site. But what we're doing now is working with 30 systems that have volunteered, that have signed up because they see and feel the importance of this and have seen, quite frankly, some of the positive outcomes, to push it across all of the different settings ultimately in their systems. It's super exciting.
Yeah, and that's really interesting. And I think that's one other key point for those who might not have participated in the age-friendly work to date, is that this framework fits in any unit. And even being in a single organization, it could mean something very different based on from one unit to the next. And that's the whole point of this framework, is that it can be tailored to fit the needs of the unit and the organization, whether the type of setting you're in. You know, you had spoken about the hospital that you're working with is a little bit of in a rural area. You know, we also have critical access hospitals and you know, within the rural areas, of course, and academic medical centers. So this is literally tailored. You can tailor this to fit any care setting. So, and I think, you know, you mentioned that it's in the convenient care clinics, the CVS.
Yes, absolutely. Well, so we're now moving to spread through all parts of the health system. So we started with age-friendly health systems with the Geri ED work that I mentioned and the surgery work, the geriatric surgery verification. Well, now we're talking about, as you mentioned, CVS Minute Clinics. All of the Minute Clinics in the country have been in the process for several years now of becoming age-friendly, which is super exciting.
It's huge.
In addition, I mentioned nursing homes and ambulatory care settings. PACE sites. So for folks who are not familiar with what PACE is, it's an acronym that stands for Programs of All-Inclusive Care of the Elderly. Really, it's everywhere. And in fact, there are crosswalks to some of the community-based organizations that are doing work in partnership now with health systems as well.
That is so amazing. And we could talk for hours, but I know we're at time. So just wanted to thank you one last time and pause to say if there are any other comments that you wanted to just give to our action community, people who are thinking about joining or people who are well on their path, anything additional you might want to share.
I would love to. There are some other expansion areas that I didn't mention. So that includes things like age-friendly health systems for caregivers. So caregivers are themselves a twofer, right? Because it's their health impacts not only themselves, but also the person they're caring for. So this is not just about the care recipient, but the person who's doing the work for them and really working that in. The Veterans Administration is doing this work across the country. So we're very excited about that. And we're really thinking through and implementing age-friendly care in home-based primary care. This is care for people who can't get out of their home to go to a primary care clinician of some sort, hospital at home, so back to the hospital, but really thinking about that kind of hospital-level care at home for those people where it's appropriate. And many, many others are joining the movement. So the last thing that I guess I'll say is that there are other funders who are increasingly joining this work as well. So depending on where a health system is, there may be funders in your community that will help you to not just join an action community, because we fund those, but to really implement the principles of age-friendly care, to measure the age-friendly care that they're implementing.
That's huge. So
Yeah.
that data, right, not only helps the organization itself, it can help other teams that are looking and thinking about it to build that case and bring that back to their own organization. So there's so much data out there. Be sure to look for it on all of our websites.
You bet.
Yeah.
Thank you. We're doing some work with UCSF to be sort of the national clearinghouse of some of that work and to lead some of the evaluation and outcomes on the age-friendly health systems work. So we invite everybody to join us. All we want really is to make sure that every older adult everywhere they are gets best possible care.
I love that. Thank you. Thanks for being here with us today.
My pleasure.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.